There's maybe everybody should mute.
Thea, you are muted.
Sorry about that. Good morning, everyone, and happy Wednesday. Welcome to the School of Global Health Management and Informatics Webinar Wednesday Summer Series. A couple of housekeeping items before we get started. To our attendees, please be sure that you keep your microphones muted and your web cameras off. We will be taking questions from the audience at the end. We ask that you use the chat function to submit your questions at that time. Our host will read them to the panelists in the last 10 to 15 minutes for the open Q&A session. Please also remember that this is a live event and do your due diligence to keep your personal information protected. For any current students in attendance, this is a UCF event, so all student code of conduct rules and regulations do apply. Thank you so much. I'm going to hand it off to our host to get us started. Go ahead, Katie.
Thank you so much, Thea. Just to let everybody know, Thea Samaki is one of my colleagues here at the school that works in our Health Informatics and Information Management program. If you have any technical issues, she'll be on standby, so please message her privately if you have any troubleshooting issues. My name is Katie Terry, and I'm head of the communications for the School of Global Health Management and Informatics and your friendly webinar host. I'm thrilled to have you with us this morning. Today's topic is global health. The School of Global Health Management and Informatics gained its new school designation in part from all of our global initiatives, partnerships, student opportunities like study abroad. I would like to start off by introducing my colleagues on the faculty heavily involved in our global work. First, we have our founding director, Dr. Sui Ho, who not only has clinical experience abroad, but also continues her research in healthcare, highlighting things including the conducting of culturally sensitive study instruments in healthcare. Dr. Ho, can you tell us a bit about the school and what your vision for the global initiative looks like in the coming years?
Sure. Hi, everyone. Thank you for joining us. We are really pleased for this global health webinar opportunities. Our school officially became a school this past May, so we are marked 3 months young now. We're really thrilled. We were originally a department of health management informatics, and now we're expanding our mission to global School of Global Health Management informatics. And really, we see global is the trend, particularly during this past pandemic. We are all one global community. Issues affecting one country actually impact the whole globe. So we are really thrilled that we have this capacity now to broaden our mission capacity to be able to foster globally minded and locally engaged leaders in healthcare.
Thank you so much, Dr. Ho. Next, we have Dr. Yara Asi. She is a 2020-2021 Fulbright U.S. Scholar focusing on the West Bank. Her research agenda focuses on global health and development in fragile and conflict-affected populations. Dr. Asi, can you tell us a little bit about the West Bank? What countries are included and some key factors your research will bring to light?
Sure. So good morning, Katie, Dr. Ho, and Dr. Ramirez, and it's nice to meet our other panelists. I'm Dr. Asi. I will soon be an assistant professor in the department. So my Fulbright is for 2020-2021, but due to COVID, I won't actually be able to travel until fall 2022. So it's a bit like how we're having the 2020 Olympics this year. That's kind of how I'm seeing it. So the West Bank is part of the Palestinian territories. I will be traveling there again, hopefully in fall 2022 to assess the health outcomes of the movement restrictions. This is obviously a conflict-affected region, and there have been decades of movement restrictions that limit healthcare accessibility to the regular civilian population. So I'm embarking on a 2-year mixed methods project to do focus groups, interviews, and then ultimately do a cross-sectional survey to evaluate how insidious these movement restrictions are, what health outcomes come out of them, and potential ways we can mitigate against them in the absence of political resolution. And I think that's what's really interesting about global health, is that it intersects with all these other factors, and it just makes for really meaningful work. So I'm happy to be here.
Thank you so much, Dr. Asi. We're definitely looking forward to getting back to traveling and being a part of all of that research. Last but certainly not least is Dr. Bernardo Ramirez, our Director of Global Health Initiatives in the school. Among his other outstanding achievements, Dr. Ramirez has both clinical and administrative experience, conducted research and technical assistance for the World Health Organization and other international health agencies and organizations across the globe. Dr. Ramirez, before I introduce our guest panelists, can you give us a brief overview of the school's global partnerships?
Sure. Thank you very much. It's a pleasure to be here. And well, as Sui already said, our director now of the school, the approach that we take to global is this approach of glocal. So to think globally, act locally. And so we try to look at different ways to interact with our partners. We have a significant number of partners in different countries, and we have now with us two of our partners, Professor Cicchetti and Professor Gabuti from the Catholic University in Italy, in Rome, and Dr. Iñaki Villanueva from from the Anáhuac University in Puebla. But the important thing is that this is an opportunity for the students. A lot of people think that global is only to take a plane, go someplace else, you know, get ready your passport and travel. And that indeed is one of the ways to experience global. But global, especially now in these times of the pandemic, has to be extended in many different ways. So what we're invigorating our relation with our partners by developing many more activities than just, you know, taking a plane and going. I love that, but we cannot do that anymore for the time being. But we can do very significant collaboration with our partners, and so we're doing what we call COILS, which is a collaborative online process that basically has our faculty and students interacting with faculty and students with some of our partner programs, and we're also teaching, co-teaching with our partners some of our courses in our program. So we're having some of our faculty, and we're inviting some of the faculty from our partner programs to co-teach in our classes. We're already planning some study abroad and some tours that people do coming to see our U.S. healthcare system. And so we're expanding on some of those collaborations with our partners with a diverse number of activities that I'm sure they will be able to tell us in more detail. But there's a lot of things to do. Even if we cannot travel, we can interact with them. We're going into a new normal, which will be very different from before. It's not that we're going to stop doing online and we're going to go all face to face again. It's that we're going to take the best of going face to face, because there's some things that you cannot substitute when you go someplace and you see something, smell, feel what's going on. It's very different than just doing it online. But we're going to also take advantage of everything that we've learned during this time of how to do good online and virtual communication.
Thank you so much, Dr. Ramirez. We'll actually talk a little bit more about some things you mentioned just now, the COIL and the partnerships that we've got. That's kind of the perfect segue. It's definitely my pleasure to introduce our esteemed guests joining us on our panel. First, we have Dr. Americo Cicchetti. I don't know if he's here yet. He may be joining us a little bit later, but he is the director of the School of Healthcare Management at the Catholic University in Rome. Also from the Catholic University in Rome joining us is Dr. Irene Gabuti. She's the director of the Executive Health Administration Program. And we also have the head of the Healthcare Quality Direction and Management of Health Services subjects, Dr. Iñaki Villanueva from Anáhuac University, Puebla, Mexico. Welcome, panelists, and thank you again for taking the time to be here with us. I'm going to go ahead and start firing different questions to each of you, but please feel free to chime in if you'd like to add to our colleagues' discussion. I'll go ahead and start with Dr. Villanueva. You have also been the head of the Department of Medical Care for the Institute of Social Security and Services for Workers of the State. Can you give us a brief overview of that work and who you were really working with on that aspect?
Yeah, well, first and foremost, thank you for the invitation. I'm really glad to be here with all of you today. And yes, until recently, about a month and a half, 2 months ago, I used to be the head of the department for medical attention for what is the system for Social Security for workers of the state, a federal state here in Mexico, which by its letters, it's called ISSSTE. And I was in charge of all medical attention for first and second levels of attention in the state of Puebla. So under my responsibilities were primary care, epidemiology and such, nutrition-based programs, and educational programs. So under my wing was the responsibility for the formation of new healthcare, the physicians and nurses and such that we had in the institute. And since the pandemic broke out back early 2020, and it was declared a pandemic as such by WHO, I was in charge for all the information that was generated by the Institute in the state regarding COVID-19. So new cases, death tolls and such, they were all under my responsibility, as well as preparing all of our medical units to attend COVID-19 patients, which were 42 medical units across the state, which is a big state. So it was quite a challenge, but it was interesting.
So what was the impact of some of the work that you did there? Have you been able to see how it's going or what it'll look like in a year?
Yeah, we started a program which it's called ECOS, which it's a preventive, preventive medicine program, which the idea is that we try and go out to the field. We actually started in October 2019, and it had to be shifted to an online modality due to the pandemic. But what we were doing is we went outside of the medical unit and we go and give courses to the general population. We would take vaccines, we would go and take exercise like events and such to the people in order to prevent chronic diseases, because chronic diseases in Mexico is quite an issue, obesity, diabetes, hypertension and such. So the idea is to try to help the population, to make the population learn before they develop those diseases. And we started that program here in Puebla, and eventually it grew to the whole country. It's now a nationwide program. And last thing I heard right before I left, we were doing really good. The authorities of the Institute were really glad with the results that the program was having. And I actually spoke with a friend a couple of weeks ago that she still works in the Institute, and she's now in charge of the program for the state of Puebla. And it's still going really well. They're still in an online modality because, well, down here in Mexico, there's still certain restrictions as to what you can and you can't not do to the pandemic, because also vaccination is not going as fast as we would like it to go. So that restricts us a bit. But it's interesting to see how we started this program that was really focused on working one-on-one, face-to-face with the population, and we shifted it to this online modality. And even though many people were hesitant to the idea that the program had to shift to an online-only modality, how it actually went ahead and it worked. How people still wanted to engage with the program, even though it was a new program. And it was novel in the fact that ISSSTE is an institution that is focused to a very specific segment of the population, which is federal workers of the state. And this is actually one of the few programs that the Institute now has that focuses on the general Mexican population and not only on federal state workers.
That's amazing. It's really interesting to hear what other countries are going through and how similar some of the aspects are to the US, et cetera. Dr. Gabuti, on that, why do you think global sharing and collaboration on healthcare administration is so important?
Well, first, thank you too for inviting me. I'm very glad to be here with you today. It definitely is very important because we are all facing so similar challenges. Although our healthcare systems are possibly very different, the Italian system, for example, is very different from the American one in many ways. I early discovered in my career that the problems we're trying to face are so incredibly similar. And so, indeed, the solutions possibly are quite similar too. They may be adapted to our context. They may have to be interpreted on the basis of our specific context, but the main challenges are really the same ones. In particular, as you were mentioning just now, the challenge of facing chronic diseases is what we really have to do now. We have no time left to rethink our healthcare systems in order to redesign them in a really patient-centered approach, so to follow patients across a continuum of care, which is likely to be very long.
Yeah, you already mentioned this, but with the recent pandemic, it's really highlighted the importance of the collaboration and all of that. How has the reporting across the world or the globe impacted how you guys make decisions on that?
Oh, well, reporting is now a big topic, and actually being able to think of a patient-centered care is quite a lot about reporting and being able to put the right data in the right place. I believe initiatives as this one today are very relevant in order to benchmark across countries and see how clinical pathways can or should be designed in the most effective way. And when I speak about clinical pathways, I'm not only mentioning, clinically what patients should be doing across their continuum of care, but really very much what we should be measuring across this continuum of care and what we should be doing with the information we are measuring in this pathway.
That's very good information. Dr. Villanueva, both you and Dr. Kabuti have talked about a little bit of that reporting and gathering the information. Just for the informatics side that we focus on, what kind of systems are you guys implementing for reporting, data records, etc.?
Well, down here it's a bit rudimentary, believe it or not. We work with Excel, and it's all throughout email, and that's because on the public side, there's not so much a focus to invest in a platform for specifically for the pandemic. They're working with COVID, but there are certain systems that the Institute already has that we use for the generation of information, and they're in-house programs. So they've designed this platform, which is called CMIF, which stands for Medical Financial System. And what it does, it's kind of like a medical record, an electronic medical record, where the doctor, nurses, the administrators, everyone is putting in information regarding medical attention, hospitalizations, bed rotation and such. And afterwards, from that same program, you can generate all the statistical information that you need and transport it so that you can report it and see how the Institute is behaving, how different hospitals are behaving. And then you take that information and you match it up with the indicators that the Institute has already designed in order to evaluate how the day-to-day work is going on.
That's such a great explanation of it. We do a lot of health informatics and information management and EMR analysis. I think that's the most eloquently simplistic way I've heard it explained. The informatics and the record keeping side, I was just like, that's exactly how we should explain this. Because a lot of times it comes down to digitization and medical records, and a lot of people aren't understanding what those mean. But that was brilliant. Thank you so much. Dr. Kabuti, back to you. You'll be joining us, I believe, in the next academic year for a research fellowship, which we're definitely excited to have you. Can you tell us a little bit about what you and Dr. Ramirez are going to be working on?
Yes, indeed. Well, pretty much in line with what I was talking about before, what we would like to do together is to start from the awareness that we are in a changing world, in a changing healthcare system, in many changing healthcare systems, which are shifting towards patient-centered care. And by shifting, this implies that the competencies of the people who have to drive this change also have to evolve and change as a consequence. What we would like to do is therefore to try and make stock of our experience in terms of creating professional profiles and defining some key competencies that are needed in order to either work in healthcare organizations that are more and more connected among each other, or also drive these processes of change actively. We are convinced, I think, Bernardo, correct me if I'm wrong, that the competencies that we need are probably very much the same in Italy and the US, because exactly these patterns of transformation are so incredibly close.
That's awesome. We're excited to see you here. We're definitely excited to have you be here. So fingers crossed, we can get control of the pandemic and you can come on over and work with us on
Hopefully.
that. Yeah, I know a lot of our students would really benefit from the work that you guys have been doing. Speaking of that, Dr. Ramirez, you did mention the collaboration online international learning, or COIL, and you do some work with Dr. Villanueva. Can you give us just the general goal of COIL and what its impact is going to be for education across the world?
Yes, of course. Well, this idea of COIL that we've been working on for now a couple of years, it's a simplified version of interacting or teaching abroad, or for somebody to come and have some learning experience here. And the idea is that what we have done is that we build like a module within our courses. Dr. Iñaki Villanueva teaches a course on management for the medical students in Anáhuac. So medical students in the U.S. also in the U.S. but in Mexico, they have to take a course on quality, a course on organization, a course on leadership. So he teaches that course, and we teach here, of course, our students in health administration. So what we've done the last semesters is that we pick a topic. In this case, it's sustainability, for instance, of healthcare systems, and then we do a joint session where we both do a conference, present some ideas, and then the students interact both online in that time. We split them in groups. We get them to work with each other, to exchange ideas, to compare what each one think from the diverse interprofessional perspective, because there are doctors, clinicians, and administrators, and also from the perspective of the two health systems and countries. And then we leave them 2 or 3 weeks to interact and do a little paper as an assignment, and then we meet again on an online class where the students come and present their findings and their papers and what they learn, and so that becomes sort of like an assignment that is shared with the other professors. So he grades his own students. He includes that into his own course. I do the same with my students, and so it simplifies a little bit some of the administrative things of dealing with 2 universities and 2 systems and 2 courses, and we've been able to do it very successfully. I have to add that one thing that has helped us very much is that in Mexico, it is mandatory now for the students to take some courses in English. So this class, for instance, even when they don't teach with us, Dr. Villanueva teaches this class in English to the Mexican students. So the students have to show some level of proficiency in English when they come to take these classes. And it's similar to Europe, where for instance, the case of Dr. Gabuti, the same thing. The students that do the masters in health administration also do it in English, their courses. So this facilitates our interaction very much, and I think it's going to be even better. And you can see by the intervention of the 2 of them that there's a lot of things that we can learn from other countries. People think that it's only like a very exotic place, wherever Italy or Mexico, it's some place where you go eat enchiladas and pasta or whatever you do, and which is true. It's also an exotic place, but it's not so exotic. At the end, we're more similar than different. And the systems have very similarities and things that we can both learn from each other in a very good way. So COIL is a very effective way. I don't know if Iñaki wants to add anything there.
If I may chime in, actually Iñaki and Bernardo and I, we have been actually collaborating through international conferences presenting our COYO model. And I see from institutional perspective, these are embedded in our infrastructure. So any university, if they desire or they like to work on this, we do have existing infrastructure. Students actually are taking courses within their own home institution. So there's no additional cost for this, and everything occur online. So it's really an innovative, creative way to still maintain that global connection and interaction and exchange, despite the pandemic prevented us from travel. And for a lot of students, I do study abroad. I'm originally from Taiwan. Study abroad is amazing, life-changing, but not every student have the financial support or time to be able to go. So COYO is an alternative for students. And one of our goals for our new School of Global House Management Informatics is to establish more COYO opportunities for our students with different international partners.
Yeah, and Dr. Villanueva, you were going to add?
Yeah, I was going to add that just like Bernardo said, it's been a fantastic opportunity also to expand our curriculum for the students, because it allows this opportunity to go outside our usual syllabi and add a topic that we wouldn't usually touch upon and talk about it with our students. And this exchange of ideas that has occurred between my students, which like Bernardo just mentioned, they're medical students, which down here in Mexico is different to how it occurs in the US. Over here, it's kind of what would be an undergrad. It's not a specialty program. I don't know how you guys explain it. But these are students that just went out from high school. They just graduated a couple of years ago, and they're being faced with the opportunity to talk with people that are actually out there in the field who are working for a living day to day and hospitals and administration. And that's been a terrific experience with them. I had the opportunity to talk to some of my students after the core module that we did last semester. And they were really glad with the opportunity because Dr. Ho just mentioned it. It's this opportunity to have an abroad experience without having to go abroad, which the university does have that sort of exchange program. Some of our students do some rotations abroad. In fact, one of my former students just went to San Antonio, to Texas, to do a rotation over there during the summer. But most of our students don't get that opportunity. So the COIL, since the class is a requirement for them to graduate from med school, the COIL is an opportunity for them to have this experience of interacting with people from abroad, from all over the world, and learning more from them and taking that into their practice further on in the future.
Definitely. You know, you all bring up great points of being able to still have that global collaboration and working together on the online spectrum, not just because of, you know, those who might not be able to go abroad or leave for that kind of program, but especially with the pandemic and what it showed us, you know, we definitely still need to maintain the connection with other countries and collaboration, et cetera. So it's such a great thing. But additionally, we do have some in-person, we've actually previously hosted and plan to host again programs at other universities, such as one of the main ones is Javeriana University, which I believe is Columbia, where students from our respective programs will visit for approximately a week, you know, learning about the different health administration aspects. And it has deterred us from doing it recently. However, we still plan on continuing that. Dr. Ramirez, if you can, give us a quick breakdown. What do those look like and how do students get involved?
Yes. And that's one of the points that's what I was saying about becoming like a better new normal in the future, because even though we're going to start traveling, it's not going to be a substitute for the COIL. I think the COIL will continue because it can be combined like the online with the face-to-face. I mean, ideally with the students in Mexico, for instance, and that's what we do with the students in Colombia from Javeriana. We plan some study abroad courses. We hope to do one in the next summer if things improve, and they usually come here in the fall. And they're planning to try to come this fall if things deteriorate very much in the next weeks or months. But that idea of students coming here to do a visit, they look at our hospitals, they interact with our faculty, they look at our communities, and they basically think, how can they do something different, or how can they apply what they know from their country or take it back. And the same with the study abroad. And I think we will continue with both things. We will continue with the face-to-face, like this study tours that they do here and this study abroad that we do over there, and incorporate also the COIL opportunity, because what better way to prepare for a study abroad than to have some interaction online that is as lively as possible with the students over there. So when they go there, it's not a completely new place. It's not a place that they don't know. It's faculty that they already probably have interacted with. So maybe some friends that they already have online that they find face to face when they travel. So combining both, I think, is going to be very important. But indeed, we are trying to maintain our tours of Colombian students that come to our university and to see our healthcare system here.
Yeah, it's definitely an awesome opportunity. I remember the last time they came over here, it was very exciting, and they definitely got to tour a lot of our hospitals and see a lot of that. Dr. Ho, speaking of our in-person, you are also the lead on our study abroad program to Taiwan, which is another program that's been delayed by the pandemic, but as we're hoping, as things stabilize, we definitely will gear up again because it's a great program. Dr. Ho, can you give us some insight on the study abroad program? How long is it, and what do students cover while they're there?
Yeah, so a lot of university and higher education are starting a variety of study abroad programs, because we realize only 10% of the American students go study abroad, which is really a very, very small percentage. And we really need to increase that, because we have a lot of students internationally come over to the US, but our own students are not going abroad. So this is really an intent for students to have sort of a short-term intensive opportunity to go together in a group setting and study abroad. And so normally it's less than 6 weeks for short-term study abroad, and it's faculty-led, and it's credit bearing. In other words, you are taking a formal courses at your home institution, and that could count towards your program of study. So essentially, you're learning a course in a very fun way, and through travel to another country and interacting with your international partners there, but in your own specialty area or an area you want to further. And this is really a trend. Now our employers are looking for new employees having that kind of cultural sensitivity, global experience, or diversity perspective. So I have been doing study abroad since 2011. Even before I joined UCF, I started the study abroad program at University of Georgia, and then I brought it over here and customized to our own student at UCF, and have seen a lot of life-changing stories and impact and experiences. Myself, I'm originally from Taiwan, so I actually studied abroad over to the US, and that has been life-changing for me. It changed my whole life and even my career. I see the same comments from students. They have always commented this has been the most unforgettable experience. The people they meet, the new friends they make, they still keep in touch through Facebook and our social media. And we can learn so much from textbook, but it's just so different. Once you are immersed in a totally different environment, you start appreciating, hey, being able to communicate in the same language is a blessing. And students have to be creative about ways to communicate using their own body language, using Google Translate. It's that kind of experience transforming them. And also visiting the different healthcare organizations and seeing my courses about aging, seeing the aging society and how other cultures treat older patients, older adults. So I have students, I can read a couple of comments. It's just very impacting. So one of the students says, the experience was truly unforgettable. I have learned so much about Asian culture. Their generosity, honesty, openness, sense of respect was something that I could apply in my personal and professional life. And this is really the best memory ever. And we actually still keep in touch through Facebook and social media. And it's different. For many courses I taught, this is obviously one of my favorite. And the depth of relationship a faculty can establish with students is totally different. Even though it's very short, students feel like I know them a lot better than a lot of professors who have taught them for 3 years. Because we're there 24/7, and I'm not just their instructor, I'm their mentor and nurses and mother. um, it is everything, and it's just life changing. And I will hope that more of our students will have this opportunity to experience this. And I think connecting with COIL will be a great model. That's a lot of work, honestly, but it's very rewarding, very worthwhile. I have seen students changing career path and rethinking about their life. And this is just very, very good for both country, both way, for our student and also for the country that we are visiting.
I think that's excellent. You can definitely see the passion in the students that do come back. And, a lot like you, Dr. Gabuti and Dr. Villanueva have mentioned, that patient-centered and getting that cultural awareness and that sensitivity and understanding as an administrator in healthcare, it's not just about doctors and patients treating the symptoms or the patient. It's working together and collaborating between clinicians and the administrators to treat a whole person. And sometimes those whole persons are from a different culture and having that sensitivity. So I definitely agree with you. Dr. Ossie, as we've highlighted this importance of understanding that global aspect and health management, what are some other ways that students can get that international experience while they're going through their program?
Yeah, I think this is a really important question. I'm fortunate to teach the Cornerstone class, which gets a lot of students that are new to our major. And I'm also the faculty advisor for the HSA Student Association. So I talk to students frequently about their career goals, their fears, their challenges. And a lot of them, we have a lot of non-traditional students at UCF. We have a lot of first-generation college students. So I think for them, the thought of global health seems intimidating or overwhelming, or maybe something that's for other people. And what I'm really excited about with our school change is for these students to see global health as something that they can do without leaving the country. I mean, global health work is still continuing without travel. And that's because I think global health teaches us that. So to me, the difference between international health, which is just studying the healthcare of another country, versus global health, which is kind of this assessment of the structures and the systems that affect all of us. I mean, COVID, of course, obviously has kind of illustrated that perfectly. But I think it can be difficult for students to maybe manifest, especially as an undergrad. So obviously, I mean, there are ways to get involved academically. Students can write papers about global health. They can write papers about health structures. But there are many, many fellowship, scholarship, practicum opportunities for students that are interested in global health, because they often do involve travel. They come with a nice bit of money for a student who may not otherwise be able to afford such travel. They come with opportunities to meet with and network with professors and students who will someday be their future colleagues at other institutions in other countries. As Dr. Ho and Dr. Ramirez and our other colleagues have said, especially for students who maybe haven't had much overseas experience or have never interacted with a health system overseas, even if you don't work globally and you just work locally, it completely changes your perspective on health, period. I mean, healthcare systems are different. We all have different types of insurance and, politics and laws and this and that. But at its core, all humans have the same health needs. And I think when students are given the opportunity, if it's through a paper, if it's through watching a documentary, or if it's through the opportunity to receive one of these great fellowships, like there are Fulbright Awards for students where they can be sent to some amazing country to teach English for 6 to 12 months, to potentially work with faculty on a global health initiative or project, or just do research support. And it's an unparalleled experience. And again, even if you don't choose to work globally, you don't have to work in global health work to benefit from a global health experience and perspective, even if you just bring it to your own clinic or hospital, or whatever, whatever facility you're working in the US, your perspective on the people you're interacting with, how healthcare is done, allowing yourself to challenge the assumptions that we all travel with throughout the day, just by being exposed to something else, I think it could be life-changing for a student, especially at the beginning of their career.
Thank you so much, Yara. Sorry, Dr. Ramirez, you had something to add?
Yeah, I would like to add something to what Yara said very, very, very nicely. I think you said it very well, Yara, that really this idea of global learning is not really international, is not really going abroad, is not all of that. It could be some of that, but it's not necessary that. We've done in the last year several study abroads to different places. We actually did to Brazil and to Slovakia. We did some study abroad where we broadcasted the study abroad from there to our students that were here in Orlando and students that were in other countries. So there are many ways to facilitate that interaction. But the basic notion is this idea of that Yara just said, that students should not think that study abroad you need a passport, you need to travel, you need to immerse in dangerous situations or in situations that are unfamiliar to you, but that it's really another way to say it is also that learning from your immediate, not your immediate community, but the community that goes beyond your immediate community, it's already global. I like to call this study abroad, study away and study abroad. And we've done some things away, not abroad. I mean, you can go to Georgia, you can go to New York, you can go to Pennsylvania, and you will see situations that are very different from the ones in Florida. The markets are different, the populations are different, many things are different, even though we're in the same health system. So study away, which is something that we also are doing, and some of these study abroad programs, we've done it in conjunction with other universities, for instance, Scranton University. So we put together students from there and here, and you would love to see how much the students, just even without getting to the other country, as they're traveling in the airport, they start talking about what is life in Scranton and the health system there, and they live in these farms and the mountains and the coal miners and I don't know what. And then the others here, this group of students from Orlando that have never seen a mountain or a coal mine or anything like that, but they have other realities and other ideas that are so diverse from the others, and they are starting to learn out from away as even before they get abroad. So I think our notion, as Sui said, of this global health management informatics school is not just to be traveling all over the place. It's not to get everybody a passport, but it's to really get this notion that global learning happens studying away and studying abroad, and learning from away from your immediate reality. That could be in the next county. Here in Orlando, there are places that are so different from where we live, and they're in Orlando still, but they're in a different county, and they handle things in very different ways. So people can learn from the clinic that we have in Apopka, where we go and practice there some healthcare experiences. All of that is, in my view, global health management informatics. To that extent.
That's such a great way to discuss it and talk about it. Thank you for adding that, because that's very true. The whole global aspect is, it's not just all over the world, it's also your neighboring state and your neighboring county, because all of it is different. Dr. Gabudi, Dr. Asi had mentioned something about careers and talking about the global career, coming from Italy and working on this global aspect of healthcare management. Can you give us some examples? What kind of careers where the global exposure or just this global mentality really comes into play?
Well, Italy is by now pretty much about global careers, meaning that most of our universities are investing, included ours, of course, are investing a lot in this direction. So, as you were all mentioning, this is not necessarily about traveling or is not necessarily about being for long times of your life somewhere else. It is really about having a network, a global network. And if a undergraduate or a graduate course starts and then finishes, your network will never finish, will never end. That's a long time investment. So that is really what most universities here in Italy are now trying to offer to their students, the opportunity of really designing and thinking and choosing where they want to be, what they want to do in their lives in an international perspective. You might remain in Italy, you might go abroad, but even if you are in Italy, as most of you were mentioning, you might discover that you have problems, challenges that are very similar to those of another country, and you might want to partnership with another country. You might want to understand which solutions have been adopted in another country and come up with the awareness that they are pretty much the types of solutions you may want to implement in your country or in your city. So academia here is now it's going towards being global. All of us, all of my fellow colleagues are keen and traveling abroad. I am, as you know, but it's really what it is all about here in Italy right now.
That's excellent to know. Thank you so much. So before we move into our Q&A forum, I do want all of our panelists to kind of think of what would be your one sentence advice for students or current professionals that are wanting to go deeper in health management field and the global aspect of that, right? Just think on that for a minute on what would be your one sentence advice on that. And to our attendees, we are opening up the Q&A, so please utilize the chat function, type your question there, and we'll fire it at our panelists, and they can answer verbally for us. So we'll give you a couple of minutes while they give us their one sentence. So I'll go ahead and start with our director, Dr. Ho. What would be like your one sentence advice?
All right, so I would say don't be afraid to go out of your comfort zone. We only come to this world once, so live to the fullest.
That's excellent. Dr. Ossie, what about you?
Well, it was something to that vein, so I will not copy my director, but I will say, appreciate the accidents and mistakes on your path, because you will look back someday. I mean, I'm sure all of us panelists, if we told the story of our career, it's never like this. It's always, a zigzag. So just keep moving forward and chase your curiosity and you'll get there.
That's an excellent point, definitely. Dr. Gabudi.
I would suggest to be incredibly passionate about what you're doing. This is an amazing and an extremely important area to work in. All of us, we can help a lot of people with the work we do. And I think there's nothing that is more important than being passionate and in love with our own job.
I think that's a very good point. All of you on the panelists are very passionate. You can hear it, you can see it, just the way that you guys talk about it. So that is definitely excellent advice. Dr. Ramirez, what about you?
Oh, I would say really just reach out to the world. It's really in your hands because it's right next to you. It's not very distant, and try to be local. Try to bring anything that you learn, anything that you see, bring it to your immediate place. Act locally, think globally, act locally.
That's definitely our key tag for the school, for sure. Thank you. And Dr. Villanueva, last but not least.
I would say that you should always be open to the ideas of others, because you really never know where you're going to find that great thought that's going to spark your curiosity or your interest in something that might have been there or you've been thinking about. And it's really going to propel you towards your final goal. So just be open to the ideas of others. You never know.
That's so great. I would really like to put all of your guys' one sentence advice together, and it would really just be a beautiful entire introduction to the industry of how students in those in their career can really go into it. So we'll go ahead and go into the Q&A. The first question that I've got here is, kind of what to Dr. Ossie was talking about careers. So we'll start with who we left off with. Dr. Villanueva, can you kind of give us a breakdown of how your career ended where it is now?
Yeah, right now I'm focusing on developing a new program for the university. We're really in the early stages, but it's a master's degree on health management administration. And we're looking to, because there are several programs in Mexico, the Anáhuac universities already have a program, but we're looking to shifting it to a more global health management idea. But it's really just in the very early stages. We're hoping to have it ready by next year.
That's awesome. So just to show the gap, what was your first job?
Oh, my first job? How could I explain it? I was assistant to the medical deputy in a hospital, so I really didn't have a specific function. What I used to do was, if a doctor didn't show up to work, I would give their consultation. If there was a need to transfer a patient to another hospital, I would hop on the ambulance and take them. If there was necessity to write a document for, I don't know, for human rights or such, I would do it. I was fresh out of med school, and it actually gave me an opportunity to really learn about the system, because I was touching so many aspects of hospital and of the institute that it really propelled me to learn. And that actually led into my second job, which was as a medical coordinator in a hospital, because I had become so fluent in the laws of medicine in Mexico and how the institute worked and such. So I jumped to that other position. It was really interesting. It was fun.
That actually kind of tracks with all of the advice given. You touched everything and you weren't afraid to go to the different opportunities, no matter how outside it was. So that's really excellent.
Yeah.
Ruby, what about you? What was your first job?
Well, my first job was as a cast member in Disneyland Paris.
That's amazing.
So that's why I'm also so excited about coming there.
That is amazing. I mean, it's apropos because we have Disney World. I mean, you can through those haunts and see how different it is. But I really love highlighting that aspect to show some of our students and those that are wanting to get into the industry, like, it doesn't matter where you start. If you've got the passion for it, you're going to end up here. You're all specialists in your field now. Dr. Ossie, what was your first job?
My first job was at Sports Authority, which I think doesn't even exist as a store anymore. And it was basically folding T-shirts and track pants for 8 hours at a time. So literally anyone can succeed.
That's excellent. Dr. Ho, what about you? What was your first job?
Well, my first job was working at a major teaching hospital in Taiwan. I actually finished my MPH at that time. So when I went back, they thought I'm the expert of public health, and that's a brand new hospital. They want to start a brand new department called Department of Community Health. So I was charged to start that new department, and everything was new to me, even though I have the knowledge, I have the degree. But I never had the real work experience, but it was a fun experience to be able to and try to translate my knowledge into practical word and establish a new department. And within 5 years, we have hired 7 people within that department, which was a really good accomplishment for a hospital, because community health is a unit that's spending money to buy people's heart, but not a unit that help hospital making money. So I was really proud of my first job and got lots of great experience. And I love public health.
That's awesome. Well, we've got one more question that we'll do before we wrap up here. Are there any global standards for healthcare management? I'll pose that to anyone who would like to answer.
I think Bernardo can speak to this. We are developing a global competencies.
Yeah, global standards. As Sui said, the International Hospital Federation, for instance, has been working for about 10 years, on developing a competency scheme for global health management. And it's very related to the ACHE competency scheme, because ACHE is very active in global. So our American College of Healthcare Executives, but it is a little different, because they basically brought together people from around the world. They work with many countries around the world. Irene is very active in that group, and she has worked also with the Mediterranean region, and she can tell that there's difference between Italy and Greece and France and Spain and Portugal. As they look at healthcare, they're all Mediterranean countries in the European region, but they're different. So they brought in some international perspective, some more flexibility, more looking at culture, at values, at differences that maybe we don't see so much when we think of competencies for instance, in the U.S. with the ACHE competency framework, which we should, because as I said, conditions here and in New York or in California are very different. So we should also think that way. But in this international, it's more dramatic. But the competency framework is relatively similar to the competency framework here in the U.S. So again, we're more similar than different.
Thank you so much, Bernardo. I think that's a really good point to end on. You know, the global standards are being set through our collaborations, through the way that we work together. You know, that whole idea of thinking globally and acting locally, that's how we set the global standards. So that's all we have for today. I want to thank all of our guest panelists for coming today. I know you're on different time zones, so we really appreciate your time. Thank you to my colleagues for coming. This has been a great conversation and definitely important. As a real quick, if you guys want to learn more, get involved, get in touch with us. Here's our contact information, all of our social information. We're happy to get social with you and have you come to our other webinars. We will have another one next week, and that'll keep going through the summer webinar series. Again, thank you, everyone. I hope everyone has a wonderful day, and we'll see you next time. Bye-bye.
Bye.
Bye.
Bye, thanks.
Bye, thank you.
Thank you.